Welcome to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm here with my wife Betsy, and we're talking about the realities behind plastic surgery.
This week we have a fantastic continuation of what we've been talking about, looking 10 years younger. We have a great skin tip by Marion Urban, which is in keeping with this topic. And today we're going to focus on the body. The past 2 weeks we've been focusing on the face, and today we're going to focus on the body. We're going to talk about liposuction.
And there's a lot of different kinds of liposuction. We're using as a guide the latest issue of New Beauty magazine.
We're still picking away at it, but we love it.
Because it's such a great magazine.
Yeah, it's so informative, so honest, and just so current with what's going on.
Right.
So
what's first on the list there for liposuction?
First on the list, these are different types of liposuction. So the first one is power-assisted lipo. It says it's best for the entire body.
Power-assisted. When I was a resident, we lobbied for our residency program to buy us one of these.
I remember that.
Because it really helps the surgeon save their energy. If you've seen liposuction on television, it can be pretty barbaric.
The surgeons get a real workout. They sweat.
They do, but
yeah.
You know, actually on television I think that's a little dramatized because in fact when I do liposuction it's more like playing a violin rather than really
chopping away.
Yeah.
Right.
But anyway, you know, there's a lot of motion going on, and when you do a large amount of liposuction on someone, it would be nice to have a machine do the pushing for you. And that's what power-assisted liposuction is. It's a machine that vibrates the liposuction cannula very fast. So the surgeon just sort of guides it in. Doesn't actually have to do, right.
Interesting. And then you're actually, I mean, isn't the patient then receiving more per cubic inch?
You know, in fact, there's no difference between standard liposuction and power-assisted, except that there's less surgeon fatigue, so perhaps maybe they can spend more time on the fine finesse areas of liposuction, so they have more energy to do that rather than trying to get the big chunks of fat out, so to speak.
Okay,
to
great.
be a little gross, sorry.
That's fine. That's what it is. That's what we all want gone. Okay. All right. So next, you ready for the next one?
Yes.
The next one is water. I've never heard of this. Water jet lipo. Best for large volume lipo.
This is still in the experimental stage. It uses high frequency water jets, tiny little ones, to break up the fat cells, and therefore it's easier to suck them out. A lot of these things that we're about to talk about today, whether it be water or radio frequency or ultrasound, we're going to get into that. What they do is they break up the fat cells, and then it's easier to remove them. And the thought is that if you have some energy source or water breaking up the fat cells rather than the muscle of the surgeon, that it's
gentler?
Perhaps gentler, and in fact that may be an issue. But the thought is that you're able to sculpt the fat better that way. If you're not spending all your energy trying to break up the fat cells, but something else is doing it for you, then you can sort of guide the cannula around more easily. You know, water jet lipo is still not ready for prime time.
Okay, wait, why did you say it's an issue if it's gentler?
Say that one more time.
Because I said, is it gentler? And you said that
we're going to talk about that in a second.
An issue.
Right, here's the issue. Go to the next one.
Okay, the next next type of lipo is laser-assisted lipo, which we call, the average people like ourselves, other than Dr. Ronel, call it smart lipo or cool lipo, and it's best for the body and the face.
Laser-assisted lipo is great. It's a great idea. It has not been around for a very long time, and so we just don't know what the long-term effects are going to be. Having said that, technically it makes a great idea. It takes an energy source at the very end of a liposuction cannula, and that energy source, the laser, breaks up the fat cells. So the cannula can be smaller. Again, the surgeon doesn't have to work as hard.
And the patient receives less of a blunt force at the end.
Yes, but the patient receives a lot of energy, and that's where the problem is. It can cause burns.
Oh.
And that's why it's really, right now, not recommended for large volume liposuction.
Some spot treatments.
It's good for small treatments, and that's why the New Beauty magazine mentioned areas like the face or areas where there are small amounts of fat to be removed.
Like if you've lost your weight, and like moms say, or men even, they have the little love handles, but they've trimmed down everything, but yet you have this stubborn little grab a section around your love handles. That's what it's good for.
So I'm gonna have a laser
I know.
lipo.
I keep telling you to have one.
I'm waiting for a better one to come out, because actually one of my professors in New York is one of the people who started this whole Rothhaus.
Oh.
And he was bringing lasers into the operating room years ago, and he's one of the investigators in the laser lipo world, and I talked to him about it, and it's very exciting. But I'm just going to wait a little bit longer.
Yeah, you're very careful.
A little conservative.
Yeah, you're very conservative.
Because a burn in the fat is not a nice thing.
No. And what about in the hands of other? Are they doctors, or are they aesthetic practitioners? What are they? Because you hear about, come into our clinic for smart lipo and get your toes waxed at the same time.
Right.
Who can use a smart lipo?
You're supposed to be a doctor, as far as I know, especially in New Mexico. There are doctors who can supervise nurse practitioners or physician assistants, and some of them are excellent and very well trained.
Right. You just have to be careful because you don't know.
Yeah, I think there's a movement for people to jump on the bandwagon of what's new and what's hot, and this is not that expensive, we'll give you a deal if you come in, and I think there's a problem with that. There's a tendency for people to jump onto something that's really not proven and may not be safe, and then if, God forbid, there's a complication or an irregularity, how are they going to fix it if they don't know?
Right.
If they're not surgeons.
Yeah, I think people jumping on the bandwagon, I don't think it's a bad thing. I think they have good intentions, and it's fun to try new things. And this is the cycle of business. Yeah. All right, on that we got to wrap this up for a minute. We'll be back with a skin tip from Marion Urban, and then we will be right back continuing this discussion.
You're listening to Talk 1260 KTRC, the Humanity Behind the Vanity. This is Dr. Daniel Ronel, and we'll be right back.